Hello, everyone. Welcome back to our interactive NCLEX RN review session. Now we are on day 31 of the 90 days. And we are encouraging you to enroll in our comprehensive NCLEX review course. It's Stancoast NCLEX Coaching. And you can access a wealth of resources there, over about 3,000 NCLEX-style questions, and 10 hours of animated videos for flexible study. And we want you to build your confidence using our on-demand video library and also the practice exams. So learn more by visiting us at www.stancoastnclexcoaching.com. And for additional details, check out the link below. And we really appreciate your feedback. So we kindly want to share your thoughts or questions in the comments, and also we'll be happy to help out. Now, today we'll be focusing on our discussion about the peripheral vascular disorders. And for those who just joined us in the room, welcome, welcome, welcome. And I hope you had a great weekend. All right, let's get started right now. So we'll be talking about the PVDs, and the peripheral vascular diseases actually will refer to those problems, especially the circulation. And for those disorders that can affect the blood flow in the arteries and also the veins outside the heart and the brain. And so our focus today will be on the blood vessels, both the arteries and the veins. And again, I said those blood vessels that are not in the heart and not in the brain. And so we are going to talk about a little bit more onto the specifics here. And these PVDs are actually going to happen because of so many reasons. And this could be caused by the plaque buildup, atherosclerosis, and also could be the failure of the heart valves that could lead into poor circulation. Now we're going to go into the comparison between the arterial and the venous peripheral vascular disorders. So here we have the most specific disorders that will include the Raynaud's right here, which is an arterial type of PVD, okay? So you are seeing right now the Raynaud's disease, okay? And this is going to be a condition that is going to involve more of the spasms in the small arteries. That is why it is referred to as non-atherosclerotic type of disease. Okay, so take note that the Raynaud's disease is going to be triggered by extremes in temperature. All right, please take note of that. This is your clue. So it's not really related to atherosclerosis. However, it will be triggered by extremes in cold or extreme heat, okay? And this will now reduce the blood flow to the lower extremities. Now moving into the next one right here, we have the Burkitt's disease. And this is an inflammatory type of disorder. So this is now going to be linked more with the cigarette smoking, okay? And so with that, this can subsequently cause the block in the blood vessels, and this will lead to the pain and also the potential tissue damage, especially in the peripheral circulation. Again, this is occlusive inflammatory disorder. Now, under the arterial, we're going to also talk about some of the acute occlusion that may occur, and of course, this is going to be caused by the clot. And guys, don't get confused. We're still talking about the arterial peripheral disorders. And the clots can also impair the circulation, of course, with the blocking inside the arteries. It will impair the blood flow. It will cut off the blood supply in the peripheral organs or distal extremities. And this is going to require emergency treatment, or else that distal part or distal organ will become ischemic and will become necrotic. So we will not be able to salvage that if we are delaying the treatment. Now, talking about the venous disorders, on the other hand here, so we will be referring to them as the varicose veins, which are the enlarged occur to us, and they are going to be the twisted veins. And this is caused by the faulty valves. So with chronicity, okay, especially if the person has been kind of like standing probably more during the daytime, and with less activity, they're kind of like stagnant standing, like the sales ladies. This can impair the valves as well, and also this will cause poor blood return into the heart, and of course it can lead to some discomfort. Yeah, it is very painful, guys. It has that dull aching pain. Have you tried working an entire 12 hours of shift just kind of like standing? You don't even have the chance to take your break. Yeah, I've done that. And it's quite a struggle to actually work in a 12-hour shift plus the 30 minutes of report time. Yeah, no kidding. It is very tiring, and you're going to end up elevating your legs when you get home. Now, we're also going to refer to the thrombophlebitis here, which is basically the inflammation of the vein, especially when there is clot formation or there is a large clot inside the vein. And this will lead to the pain, there will be swelling, and it can also lead to much more serious complications. For example, if the clot gets dislodged, right? Maybe it's coming from the lower extremities, and it can travel into the heart and eventually will stick, or it will lodge into the tiny capillaries or the arterioles in the lungs. So I want you to relate the thrombophlebitis with the lecture that I did with the pulmonary embolism. Now, we're also going to talk about the different predisposing factors here, and these will be varied between the two. So we're going to talk first about the arterial predisposing factors. And so one of those is the arteriosclerosis, and this is when the arteries are going to get harder because of the plaque buildup. We call this atherosclerosis, and this is going to consist about 95% of the cases. So that's a huge percentage. It makes up about 95% of arterial peripheral vascular diseases, and it's going to really restrict the blood flow, and it can also lead to some heart attacks and also strokes. Now, another predisposing factor here is advancing age. And the reason for that, because when the person gets older, the arteries will naturally become less flexible. And remember that the blood vessels have that 3 layers, right? The intima or the endothelium, okay? And the smooth muscle lining as well, and the externa. These will now become harder and will become narrower, which can contribute to the peripheral vascular disease. Now, moving into the venous type of disorders here, the predisposing factors here could be the history of deep vein thrombosis, wherein if the person had prior episodes of the DVT, this can really damage the valves inside the veins, right? And this will make it harder for the blood flow to go back into the heart, and will eventually lead into chronic venous insufficiency. Now, another predisposing factor here is the valvular incompetence. And this is very common, especially for those people that have the varicose veins. And this will now result into pooling of the blood in the veins, and it will cause the extremity to swell up, and also will develop into ulcers. Okay, because of that stasis that has been going on for several years. Now, we're going to have to move further into the different characteristics as far as the skin texture. Now, we're going to talk about the arterial characteristic, wherein there will be smoothness in the skin. Also, the poor blood flow can really lead into the changes in the skin texture. There will be some shiny skin. It might appear glossy, and this is because due to the lack of the nutrients from the inadequate blood supply, and there's going to be some hair loss because of the reduction in the blood flow, which can really cause the hair to stop growing in the affected area. And when you're looking into the nails, especially the toenails, they will become thickened and they will be susceptible to the fungal infections. Have you seen those patients, especially those with the peripheral arterial disorders? Have you seen their toenails? They're quite thick and appears like they have that fungal infections there. Okay. And aside from that, there will be some, hang on a sec. This is eliminating that one right now. So basically the patient's skin will be dry, not shiny, rather, and the skin will be thin. And this is because due to the insufficient blood circulation. Now we're going to talk about the venous type of skin here. What will it look like? It will appear edematous. And the reason for that is because of the constant stasis in the lower extremities. The blood will start to pool in the lower extremities, and because of the faulty valves inside the vein, it will not really allow the forward and upward flow of the blood back to the heart. Now, the other reason for that edematous skin in the venous type of disorder, it's because of the increased venous pressure. Okay, let me try. Increased venous pressure, and there's also going to be that classic hydrostatic pressure. That's pretty much what I'm referring to. Hydrostatic pressure. And again, the reason for that is because of the vein, especially like this. So the valves that are supposed to close when the blood is trying to return back to the heart, the valves will not close when it's supposed to do that. So it will allow the blood to go back down into the lower extremities. And that's the reason why there is now pooling of the blood in the ankle area or the feet area. And that's, again, because of the increased venous pressure and also the capillary pressure that is also peaking. Now, another reason for the edematous venous type of peripheral vascular disease, it's because of the fluid leakage. And again, this is related to the increasing hydrostatic pressure. The amount of blood or fluid found in the vein itself will cause that blood vessel, the vein itself, will be kind of dilated, and it will now seep into the surrounding tissues. Okay. And there's also that lymphatic overload, which is supposed to typically help the excess fluid, but it becomes so overwhelmed that it will now also lead to the edema. Now, talking about the skin color now, guys, there is quite a significant difference or differences between the venous and arterial type of peripheral vascular disorders, because when you have a patient with a pad, hello everyone, welcome back. When you have a patient with a pad, the skin color will become pale, or there is pallor when you are trying to elevate that lower extremity. So this is very classic, guys. Don't forget about the color of the leg or the feet. It will become pale when you are trying to elevate. And it is because when you are doing that, it can reduce the blood flow further. And that's why you have that paleness. However, though, when you are going to put the leg back in a dependent position, this will now cause the color to go back into that pinkish red coloration. And this is because of the blood rushing back into the area. Okay, so again, pale when you're elevating, and it will turn red or pinkish when you put the leg down in a dependent position. Now, talking about the venous type of disorder here, okay, the color here will be different. This is going to be common, guys. I don't know if you have seen this in your patients with the venous type of PVD. Have you seen those pigment brownish discoloration in their ankle area? Have you seen those? If you have, good job. This is very common, guys, especially for the venous type. And the reason for that, it's because of the blood that was like getting the pooling of the blood in the lower extremities will allow the red blood cells to leak into the surrounding tissues. And this is what we call as hemosiderin staining. Whoops. Yeah, it has that iron content that will cause that brownish discoloration. Okay, this is again the hemosiderin staining, and this is a result of the leaking of that blood into the lower extremities. Now, there's also going to be cyanosis when you're going to put the patient's leg in a dependent position. So take note of that. It will become cyanotic when you're going to put the leg or the ankle down. So it's quite the exact opposite with the arterial. Now, we're also going to talk about the temperature. What will be the temperature in an arterial peripheral vascular disease? Well, it will be cool to touch. And the reason for that is of the poor blood flow leading to the lowered skin temperature. It's very easy because of the poor oxygenation to the lower extremities. It will be cool to touch. However, when you are encountering this patient with a venous type of PVD, their skin feel warm, and that is because of the pooling of the blood in the skin. Now we're going to talk about the quality of the pulse. This is very important, guys, because when you have a patient with the arterial PVD, what you're going to feel is that there is now a decrease in the pulsation. Probably you're only going to feel about +1, very diminished, or it could be absent. And this is going to be an emergency, especially if there is no more pulsation, if you're not going to be able to really hear any of that pulse, even when you're using the Doppler. Have you seen this Doppler or like device that you can use to check the pulse if you cannot palpate it? That would be another diagnostic tool to determine if there is still a remaining pulsation to that extremity. Now, with the venous type of disorder, what you're going to expect here is that there's probably no issue with the pulsation because it's not an arterial problem, right? And so it will still be appreciated. You can still probably feel about 2+ by palpation. Now, talking about the pain here, the pain in the arterial PVD will increase, and it will be sharp in its character. Okay, it is going to be sharp. It will increase when the patient is ambulating. This is what we call as the intermittent claudication. All right. Claudication simply means that there is that pain when the patient will be walking, and the pain will disappear when they are gonna stop walking. All right. Or it could be caused by maybe, or it will be aggravated by an exercise, and it will be relieved when they're gonna rest. And again, the reason for that is because of the poor circulation to that lower extremity. Now, there is also what we call as oh yeah, this is going to be relieved by the dependent position. So most of the time the patient will probably would just stay in the chair or recliner, not doing a whole lot because of the pain relief that they're going to get once they stop ambulating. Now, talking about the venous type of pain, venous PVD, what are you going to see here? There will be persistence in the aching, and this is going to be like full. The sensation of the pain is somewhat dull, and this is going to be relieved when the patient's extremity is horizontal. Okay, and the elevation of the leg will also relieve that pain sensation. Okay, elevation and the use of the compression stockings will also relieve the dull, achy pain. Now, you might also gather in your assessment finding that the patient probably would state that they have that like nightly or nocturnal cramps. And the reason for that is because of the pooling of the blood in the lower extremities, which can really cause the painful cramping during at nighttime. All right. Now let's talk about the ulcers, because there will be formation of ulcers on both the arterial and the peripheral or the venous type of PVD. Now, here are your different descriptions here. There will be some kind of a lateral ulceration in the legs, the heels, the toes. And again, the reason for the ulceration is the poor blood circulation, poor oxygenation. There will be clear-cut edges, and the depth will be somewhat kind of like a deep type of a wound, and the form will be kind of like circular, and the necrotic tissue will have that like lack of blood supply. There will be that eschar formation. Okay, the dead tissue will appear like that. And the kind of wound that we'll be seeing here will be non-edematous, and because there is no swelling around the ulcer. This is not a venous type. However, when we are looking into an ulcer that is venous type, it will be different. It will be located mostly in the medial ankles or thighs. The edges will be uneven, and there will be exudates because of the stasis. So there will be a whole lot of drainage that will be coming out from the wound. And of course, this will be edematous when you're gonna do that observation. Now, another is that we're gonna have to talk about slightly about the treatment here, because we're gonna do more of that in the test questions. And the treatment here will include both the non-invasive and the surgical procedures. And for the arterial PVDs, smoking cessation here is very important. We know that the cigarette smoke or the nicotine can cause that vasoconstriction. So we really want to encourage our patient to stop smoking, as this can worsen the arterial disease. And of course, we're going to treat the ulcer or the wound with a topical antibiotic in order to heal that ulcer, and make sure that we're also applying saline dressing. So this will keep the wound bed clean and moist, and also to promote better healing. And also, we're going to have to promote bed rest and immobilization at this point in order to reduce the pain and prevent further injury. Okay. Now, there's also going to be a need to the administration of the fibrinolytic agent, especially if there is going to be an involvement of a blood clot in the artery. And this is going to be really quite a rapid kind of intervention, especially when we are seeing this in the acute care setting. And so this is going to restore the blood supply to that distal extremity. However, though, this is not going to be applicable for those patients with the Raynaud's and also the Buerger's disease, because the primary reason of those disorders are not of the clot formation. Okay, so again, the fibrinolytic agents are not applicable to patients that have the Raynaud's and the Buerger's disease, because they are not caused by the clot formation. However, though, if we're going to treat that with the surgical procedure, these are the following. There will be embolectomy, wherein there is now that surgical removal of the blood clot in order to restore the blood flow. There is that endarterectomy, which is going to remove the clot and also the fatty tissue that has built up into that artery. And of course, this will really clear out that blockage. Now, if the blockage is very extensive, there is probably complete stenosis, probably, or caused by the atherosclerosis, then this would probably require the arterial bypass. And so they're going to have to create that new pathway in order to allow somewhat kind of like recirculation. So they're going to use some grafts from, let's say, other synthetic materials, maybe Teflon or Dacron, or it could be the patient's own blood vessel. So this will bypass the blocked artery in the lower extremity. Now, there's another procedure we call the PTCA, or the percutaneous transluminal angioplasty, which is going to involve the insertion of the balloon, and it will be inflated into the artery in order to compress the plaque against the arterial walls. So basically, guys, it's pretty much the same kind of procedure that is done in a patient with an MI, right? So with that atherosclerosis in here, that balloon will be advanced, or that catheter will be advanced, and this is going to be inflated, okay, in order to compress the sides, in order to open it up, okay? All righty. Now, another is the amputation. Well, this is going to occur only if the extremity is not really responding to the treatment, despite the bypass surgery, despite the pharmacological treatment. This is going to really be amputated. And this is only applicable for those severe cases, and because of the necessity to really remove the necrotic tissue or dead tissues to prevent further health complications. And this is mostly associated with those people that may have diabetes mellitus. There is really poor wound healing. They will become gangrenous. Have you seen those diabetic foot ulcers? Oh my God. They're very difficult to treat. Maybe the patient has been having this kind of wound for probably more than 5 years, off and on. It will probably heal a little bit, and maybe in the next few months it will go back to its worst characteristics. So yeah, again, that's very challenging, guys. Now, for the venous type of PVD, what are we going to expect here? Blessed assurance, any giveaway tonight? What are you talking about giveaway? Are you talking about the questions? Yes, we're going to have questions. Yeah. So hang tight. So for the PVD, venous type of PVD, there will be that vein ligation, of course. And there is also another treatment, thrombectomy, which is basically the removal of the blood clot inside the vein. There's also going to be debridement to get rid of those dead tissues. And again, if they're not going to remove those, it will prolong the healing process. And I've seen so many of these patients in and out of the OR. They're the most chronic type of patients. Yeah, I love taking care of them. Also, before we go to do that, let's talk a little bit more about the care with the PVDs, okay? And again, with the venous type of PVD, this is going to require some treatment, especially with systemic antibiotics. Yeah, this is quite challenging, guys. And most of these patients that have the PVD ulcers, they're mostly positive for MRSA as well. Have you noticed those? Systemic antibiotics. Let me just shorten that. That's another treatment, and this is going to treat the infections. And also, there is also a need for us to apply compression dressing. And this is also going to allow the application of, let's say, alginate. Have you heard about the alginate dressing? It's quite expensive. This is going to help reduce the swelling and also support the venous return. It will also improve the circulation. And don't forget about the leg elevation. This is very hard for the patient to actually comply. And even though we have given them education to make sure that they put their legs up on pillows, they just want to put their legs down while they're watching their TV, sitting on the recliner. no matter what instructions that we have provided, we put up signs on the wall for them to get reminded, but they will still not be compliant. Just telling you right now that it's very challenging to get their legs elevated, and some of those patients are non-compliant in keeping those compression stockings, right? They just don't like the warmth of those stockings. It's just too hot for them. And yeah, you just have to be really patient when you are treating this difficult PVD patients. Okay, now when we are talking about the nursing management, especially for the arterial type, okay, what we're gonna do here, especially not during the acute phase though, we're gonna have to encourage the patient to exercise, and the reason for that is to build up the collateral circulation. Again, I'm not talking about the acute phase wherein there is that immediate blockage. No, I'm talking about that in general. For the patient with arterial PVD, again, activity is encouraged. Okay, again, the reason for that is to promote collateral circulation in the lower extremities. And we don't want to really cause them to have that abrupt change in their exercise level. We want to implement that gradually and increase it slowly. Okay. And we want to make sure, though, that our patient will have to at least stop, get some rest once they have that intermittent claudication, but then we're going to have to let them walk a little bit further. So the rehabilitation here is actually going to be quite challenging, especially for the arterial type of peripheral vascular disease. And I'm not just talking about just the exercise. So they're going to be taking another medication here. And so we will be administering, and they will be taking that vasodilator while they have the PVD. They're going to take that vasodilator in order to prevent the vasoconstriction, and this is something that they'll be taking for the rest of their life, right? If they are not going to get any surgical procedure, all right? Now, also, the patient with the arterial type of PVD, make sure that you are going to instruct them to no direct heat. Let me write it down here. Arterial. Okay, don't get confused. We are talking about pad right now. So as far as like the application of, let's say, warm compress or heat compress, we're going to instruct them to never apply. So that's an X right there. Never apply heat directly into the extremity. No heating pad, okay? Because the sensitivity of that lower extremity is decreased. They will not be able to feel the heart temperature. And so this can really cause the patient to have burns. So again, no application of heat to this patient. Let me rewrite that. No heat application. Again, the reason for that is because of the altered sensation. No heat application. All right. And also we're going to have to instruct them to not expose themselves to cold temperature. No cold exposure. Because the cold temperature can cause vasoconstriction. Okay. So we are not gonna allow them to be exposed in extremely cold temperature, and also with the stress. No stress. Avoid stress. Avoid caffeine. What else? Avoid nicotine, cigarette smoke. These are known vasoconstrictors, okay? All right? I'm telling you, no heat application to the lower extremities in pad, no cold exposure, no stress, avoid intake of caffeine, avoid nicotine, because these are known to be vasoconstrictors. All right, so we're going to talk a little bit more with the different interventions as we go along with the test questions. Here we go. We have our first questions today. A nurse is assessing a patient with chronic peripheral arterial disease. What findings should the nurse expect? Okay, the question states, a nurse is assessing a patient with chronic peripheral arterial disease. What findings should the nurse expect? Is it A, swelling around the ankles and feet, B, ulceration around the medial malleoli, C, scaling eczema of the lower legs with stasis dermatitis, and D, pallor when the limbs are elevated and redness when they are dependent? Let me reread the question. A nurse is assessing a patient with chronic peripheral arterial disease. What findings should the nurse expect? Is it A, swelling around the ankles and feet, ulceration around the medial malleoli, C, scaling eczema of the lower legs with stasis dermatitis, D, pallor when the limbs are elevated and redness when they are dependent? Okay, we are seeing a lot of D's. Very good, guys. That is the correct answer. Whoops, there's my pen. Answer is letter B. Okay, again, let's go back into the changes in the arterial peripheral vascular disorder. There is going to be pallor when there is elevation of the extremity, and it will go back to its original coloration, pink or redness, when you're going to put it down. Okay, so this is characteristic of PAD, peripheral arterial disease. And again, the pallor is caused by what? Decreased O2, decreased blood flow. That's quite the most simple reason for that. Reduced blood flow. Okay. All right. If you had answered letter A, swelling around the ankles and feet, remember that this is a characteristic sign of the venous stasis, which is common in the other problem, which is the venous type of PVD. Okay. Now, if you had answered, hello, Mariama, letter B, ulceration around the medial malleoli, this is going to be common in the venous stasis as well. This is going to be the stasis dermatitis, ulceration. Okay. And if you have selected letter C here, wait a minute. Scaling eczema of the lower legs with stasis dermatitis. This is also associated with the venous type of peripheral vascular disease. So again, our strategy here is to recall for the characteristics between the arterial and the venous type of PVD. Okay, so if you're gonna look for that arterial type, always think about poor blood supply, poor blood flow, perfusion, poor oxygen. However, if you're gonna deal with the venous type, think about edema, collection of fluid into the tissues, and also the ulceration will appear mostly in the medial malleoli or the thigh. Okay. All right, let's move on to the next question here. Question 2. A nurse is providing care to a patient with peripheral artery disease who has recently been prescribed Plavix. The nurse realizes that additional instruction is needed when the patient makes which of the following statements? Is it A, I shouldn't be alarmed if I bruise more easily or if my gums bleed a bit when I brush my teeth? Or B, it doesn't matter if I take this medication with food or on an empty stomach, whichever is more comfortable for me? Or C, I should stop taking Plavix if it makes me feel weak and dizzy? And D, the doctor gave me this medication to prevent my platelets from sticking together and forming clots. Now, this test question is wanting us to select that option that reveals that the patient did not really understand the treatment, need additional instruction. That is our clue right there. Okay, so you're going to look for that negative statement. Okay, a statement that will actually signify that the patient is misinterpreting or not understanding. They're just talking gibberish. Okay, so what is that? Need. Guys, the nurse realizes that additional instruction is needed when the patient makes which of the following statements? Is it A? Are you sure? Are you sure with letter A, guys? Okay. All right, let's go through the options. For letter A, I shouldn't be alarmed if I bruise more easily or if my gums bleed a bit when I brush my teeth. So, this doesn't mean that the patient require additional teaching, okay? Because this is actually increased, right? It is expected to cause them to have the bruising. They will have gum bleeding, okay, due to the blood thinning effects of the medication. So we are not going to select this one. This is wrong, okay? It said here, additional teaching is needed, okay? So we are going to eliminate that one, okay? It is expected side effect of the medication. There will be bruising. There will be that increasing tendency to bleed. Gum bleeding, probably rectal bleed if they're constipated, or maybe they're going to end up with epistaxis if they are picking on their nose to remove the booger, right? What about letter B? It doesn't matter if I take this medication with food or an empty stomach, whichever is more comfortable for me. Do you think that this is going to need for us to reinforce the teaching? No, because this is correct. It doesn't matter because you can either take the clopidogrel or Plavix with food or without food, okay? So we're not going to select that. Like I've said in the past session we had, the food will not aid in the digestion. However, you might be able to assist the patient to relieve their epigastric pain if you're going to provide the medication with some food in order to at least lessen the gastric irritation. But again, it doesn't really matter. It doesn't lead to less absorption or more absorption. Now let's take a look in letter C. I should stop taking Plavix if it makes me feel weak and dizzy. So when they feel these two, weakness and dizziness, you should intervene here. You should re-educate the patient because these are common side effects, okay? So these are common SEs. Let me just shorten that. And we can actually let them or educate them to report these manifestations to the medical provider. And we're not going to encourage them to stop right away, okay? Because it is very important for them to continue taking that medication to prevent the blood clot formation, okay? So do not advise them to stop the medication, taking the medication right away. They need to talk to the medical provider first before they're going to stop taking the drug, all right? That would be your education, guys, right? Do not allow them to stop abruptly without notifying the medical provider. Now, going into letter D, the doctor gave me this medication to prevent my platelets from sticking together and forming clots. We're going to eliminate that because that is the desired drug action in order to prevent the platelets from clumping together, okay? So we are left with letter C. So our answer is letter C. This simply means that a patient did not understand the prior teaching. We want to make sure that we are going to reinforce the teaching. If in case they're going to manifest those side effects, make sure that you tell them not to discontinue the medication on their own. Make sure that they notify the medical provider first. Okay. Now moving into the next question. A nurse is teaching a patient newly diagnosed with severe PAD. Okay. Which instruction should the nurse include? Again, a nurse is teaching a patient newly diagnosed with severe PAD. Which instruction should the nurse include? Is it A, wear tightly fitted insulated socks with shoes when going outside? Or is it B, elevate both legs above the heart when resting? Or C, apply a heating pad to both legs for comfort? D, place both legs in a dependent position while sleeping. Okay, let me reread the question. A nurse is teaching a patient newly diagnosed with severe peripheral arterial disease. Which instruction should the nurse include? Is it A, wear tightly fitted insulated socks with shoes when going outside? Or B, elevate both legs above the heart when resting? Or C, apply a heating pad to both legs for comfort? Place both legs in a dependent position while sleeping. Okay, I am seeing Mariama answering D. Okay, what about the others? Mary answered D. What about the rest of the class? D, I guess. Yeah, you might be lucky today. Yeah. The correct answer here is letter D. Sorry about that. Answer is D. Very good. Why letter D? Well, remember about the poor circulation to the distal part of the leg or the ankles or toes. You're going to have to promote the circulation by allowing the patient to keep their legs, both legs rather, in dependent position. All right. All right. That is the correct answer. Severe peripheral arterial disease. Place both legs in a dependent position to allow what? Blood supply. Or to promote blood supply to the distal extremity. Okay, that is a correct answer. If you answered letter A, wear tightly fitted insulated socks with shoes when going outside. Just the word itself, tight, it has that constrictive effect to the extremity. And we don't want to cut the circulation. We don't want to do that. We are going to have to promote circulation. So the tight fitted insulated socks, yeah, that's not going to fly with this treatment. Removing that. What about letter B? Elevate both legs above the heart when resting. Again, this is contraindicated in a peripheral artery disease, because when you are putting the legs higher above the level of the heart, the more that there is a compromise in the blood supply. Remember that the color will start to get pale. The sensation will also be different. Have you tried this, guys? When you are sitting on the toilet for like an hour or 2 hours, and you will start that cramping in your thighs if you're just texting inside the bathroom. So the same kind of sensation that the patient will feel, right, when you are going to put their legs higher. I'm talking about the peripheral arterial disease. So make sure we are promoting the circulation by keeping the extremity lower than the level of the heart. Okay, this is to promote circulation, promote oxygenation. Now, when we are talking about letter C, so this is wrong, this is wrong. Letter C, apply a heating pad to both legs for comfort. What did I say earlier about the peripheral arterial disease? There is what? Decreased sensation in PAD. So no heat application because they have altered sensation. They're going to end up with burns. We don't want to cause that, right? No application of heat packs or hot packs. All right, team. I hope that you're able to get the rationale. Let's move on to the next. A nurse is instructing a patient with a new prescription for, they can't feel. A new prescription for clopidogrel P2Y12 platelet inhibitor. Which instructions should the nurse include? Select all that apply. Again, you are the nurse instructing the patient with a new prescription for Plavix or clopidogrel. What instructions should you include in the teaching? Now we are going to select all that apply. Is it A, avoid herbal supplements while taking this medication, or B, monitor for black tarry stools, C, take this medication when you experience pain, D, schedule a weekly prothrombin time test, and then there's also E, limit foods high in vitamin K while taking this medication. All right, rereading the question. A nurse is instructing a patient with a new prescription of Plavix. Which instructions should be included in the teaching? Select all that apply. Is it A, avoid herbal supplements while taking this medication, B, monitor for black tarry stools, C, take the medication when you experience the pain, and D, schedule a weekly prothrombin test or prothrombin time test, and E, limit foods high in vitamin K while taking this medication. Okay, please don't forget this is not warfarin. Warfarin is a totally different anti-clot medication. We are talking about Plavix. Okay, we're talking about Plavix. So remember in pharmacology that Plavix doesn't really interact with vitamin K. Okay, it doesn't. It is the warfarin that does that. Okay, so I want you to narrow down your selections here. Do not be fooled. Okay, so what would be the correct answers here? Let's start with letter A. Avoid herbal supplements while taking this medication. Well, what do you think? Is this going to be a good teaching for this patient? So let me put letter A. Yeah, we are going to promote the avoidance of the use of the herbal supplements while they are on Plavix. So what are these possible herbal supplements? It could be the garlic. It could be ginger. It could be ginseng. Okay. Please take note, guys. These are very common supplements that patients will be taking at home because these are actually going to cause some kind of like thinning in their blood. These are going to increase the bleeding. Okay. Have you noticed this? If you're really, I don't know about 7 days blood check. Yeah, the blood checks will be you're pertaining to the prothrombin time, right? And so this is going to be appropriate for those patients taking the warfarin. Okay, please take note about the diagnostic test involved for the anticoagulant therapy taking the warfarin or Coumadin. They need to have their prothrombin time checked every now and then, and especially if they just started taking the drug. This is very crucial, guys, because their body is still kind of like trying to adapt to the new treatment. And so most of the time, the frequency and the prothrombin time checking in the first 3-4 weeks will be much more frequent. And this is to at least safeguard the patient from being anticoagulated, way too anticoagulated, or maybe less anticoagulated. So I'm just telling you that this is to really determine the safe range of the prothrombin time for this patient. Okay, so I'm talking about during the acute phase or just immediately when they start taking the Coumadin. Okay, so the frequency of having the prothrombin time will be much more frequent, maybe more than weekly, maybe every 3 to 4 days. And this frequency will lessen once there is now much more stable prothrombin time. So back to letter A here. Avoid herbal supplements while taking this medication. As I have mentioned, these are the common supplements that patient will be taking: garlic, ginger, ginkgo, ginseng. These are known to increase their bleeding. So you want to make sure you're going to let them know. And this is very important, guys, especially when you're admitting the patient. You really need to obtain the complete list of all prescriptions and also over-the-counter medications. Some of these patients probably would hide some information. That would really be scary, especially if they're going to take medications that may interact with the current prescription. Yeah, that's kind of scary if they're not revealing everything. And so you got to be cautious and make sure you have to really investigate in kind of subtle manner until they will tell you that they're taking something else. And I've encountered this so many times in the acute care. Yeah, they don't want to tell everything up until they will feel like, oh, I'm not supposed to do that then, huh? Yeah, you dummy. Okay, I'm sorry, but that's just true right there. Now let's take a look on letter B. Monitor for black tarry stools. What is that? Well, the monitoring of the stools is very important, especially when they are now at home. If their usual color of the stools is, let's say, brownish, yellowish, brown, and then when they start taking the Plavix, it will cause probably discoloration. Maybe it will black color or tarry. And this is a sign that there could be GI bleeding, right? And again, it's not really the main reason that they might be bleeding, because maybe they are taking other medications like iron sulfate or ferrous sulfate rather, iron supplements. So this can also cause some black color in their stool. But again, if the patient is not taking any other medications that may cause black discoloration, then the tarry stool would really signal you, hey, my patient probably is having a upper GI bleed. And so this will require some more testing, maybe guaiac stool, in order to follow up the GI bleed. Now let's take a look in letter C. Take this medication when you experience pain. Now, we are talking about Plavix here. Plavix, antiplatelet medication. And it states here, take the medication when you experience pain. That is not a, that is a very bad information right there. The Plavix should be taken as prescribed, not only when the pain occurs, okay? So we want to make sure that the patient will maintain the therapeutic level of that medication in their bloodstream, okay? So letter D, schedule a weekly prothrombin test. Like I have said earlier, this is much more related with the warfarin therapy, okay? Warfarin therapy. So make sure you are telling the correct information. Do not give them that pamphlet that talks about warfarin. They don't need that testing because the clopidogrel doesn't have that therapeutic level lab value yet. We're only going to know if there is bleeding, if in case, or a massive bleeding, or a drop in the blood count, if they're bleeding, right? So we're going to have to determine that by their red blood cell count, hemoglobin, platelet. But as far as like prothrombin time, no, it doesn't test that. Now, letter E, limit foods high in vitamin K while taking this medication. This is what I said earlier, that Plavix does not interact with vitamin K rich foods, okay? It is the warfarin. So we are going to eliminate the letter E. It isn't gonna interact. Okay, so we are back with the answers. Letter A, And we're going to also teach the patient to monitor their stools for discoloration. Let's say black, hairy stools. The rest of the answers here are not appropriate. Okay. This is related to the Coumadin. Letter D is related to Coumadin. Letter E is related to Coumadin. And letter C is just nonsense. Okay. The medication should be taken as prescribed, not just when they are having any pain. Okay. All right. Your page 441. Okay, again, guys, we are promoting our course in our website at www.stancoast.nclexcoaching.com, where you can access all those 3,000 NCLEX-style questions, plus the lectures that we have. Our video library will give you some more information there. And also the mock exams will give you some more confidence in order to get ready with the exam. And make sure that you check the description box below for more details. All right, let's move forward to the next question. Where are we at? Next question, guys, number 5. A nurse is caring for a patient with chronic venous insufficiency in a prescription for thigh-high compression stockings. What should the nurse implement? Again, a nurse is caring for a patient with chronic venous insufficiency and a prescription for thigh-high compression stockings. What should the nurse implement? Is it A, elevate the patient's legs for 10 minutes 2 to 3 times daily while wearing stockings? B, apply the stockings in the morning before getting out of bed? C, roll the stockings down the knees if they cause discomfort? And D, remove the stockings for 1 hour 4 times a day while out of bed to allow the legs to rest. Okay, this is a very common NCLEX question, guys. Charmaine McGill answered letter B. Boss Babe answered A, B earlier. Cephas B. Mary Roberta answered letter B. Okay. Again, the correct answer for letter or number 5 item, it is going to be letter B. Apply the stockings in the morning before getting out of bed. Okay. The reason for that, it's because once they have it on, okay, this will really reduce the venous stasis. Reduce venous stasis. Okay. And we're talking about the chronic venous insufficiency, guys. Remember that there is pooling of blood and fluids in the interstitial spaces because of the weak blood vessel valves, especially in a patient with varicose veins. So again, we are going to apply these stockings in the morning before getting out of bed. So far, this is the most correct answer in this test question, okay? So, when the patient is in bed most of the night, right? Of course, we are going to put the legs maybe slightly elevated on pillows in order to promote venous drainage, right? And as soon as possible, before they get out of bed, it is a good practice. It is best practice to have them wear the stockings before they get out of bed. And this will really reduce the accumulation of fluid in the interstitial spaces. Why not letter A? Elevate the patient's legs for 10 minutes, 2 to 3 times daily while wearing stockings. Well, because the best practice here is actually going to be 20 minutes, not 10 minutes, but 20 minutes. And this is going to be done 4 to 5 times per day. This is according to the evidence-based practice. The elevation of the lower extremity should be done for 20 minutes and you can repeat this at least 4 to 5 times daily. All right. And of course, you have the stockings as well on around this time in order to facilitate the correct answer. Hang on a sec. So the correct answer, good question, Chica. Now, I think I marked this one right here. No, not letter A, just letter B, because what makes it erroneous is the 10 minutes. The recommendation is 20 minutes for 4 to 5 times daily, not 3 times daily. This is lesser. Okay, remember about what I said about the 20 minutes recommendation according to the evidence-based practice. We are going to have to let them elevate their legs for 20 minutes, 4 to 5 times daily, not 10 minutes. This is lesser. Okay, so we are going to eliminate letter A. Our answer is letter B, apply the stockings in the morning. So I hope that clarifies your question, Chica. Okay. All right, let me clear the slide. So to prevent the confusion, our answer here is letter B. The recommendation, as I have said, is to elevate the bilateral lower extremities about 20 minutes, 4 to 5 times per day. That is the recommendation. So letter A is not gonna do a whole lot of the elevation because of the less duration, and also the frequency is much lesser. So we are gonna remove that. That's erroneous answer. So our answer is letter B. Okay. Now letter C, roll the stockings down to the knees if they cause discomfort. Guys, have you seen those patients in the acute care settings with those stockings being rolled down to the knee area? Yeah, that's not cool. When I see those roll down, I would immediately tell the patient, can you please put that back on again? Because that is actually going to cut the circulation. So make sure that we are going to replace, or make sure that the stockings will be rolled up to prevent the vasoconstrictive effect of that TED hose. Okay, so we are going to remove letter C. Roll the stockings down can lead to what? Decreased blood circulation. Rolling of the stockings is never advised. Okay? No rolling. What about letter D? Remove the stockings for 1 hour, 4 times a day while out of bed to allow the legs to rest. Ooh, the exact opposite. This is not going to prevent the stasis, okay? This is going to cause more blood stasis in the bilateral lower extremities, BLEs. Again, C and D are going to cause more blood stasis in the lower extremities. Okay. Once they're supposed to be out from their bed, make sure that they're wearing the stockings. However, make sure that the stockings are not rolled down. They should be rolled up. Okay. Now let's move on to the next question. I hope that you're getting the clarity, Miriam, and also Chica. Okay. All right. Perfect. Number 6. A nurse is evaluating a 52-year-old patient who has a smoking history during a routine clinic appointment. The patient, who regularly exercises, mentions experiencing calf pain while exercising that subsides with rest. Which of the following findings warrants additional investigation? The question states, a nurse is evaluating a 52-year-old patient who has a smoking history during a routine clinic appointment. The patient who regularly exercises mentions experiencing calf pain while experiencing, or while exercising rather, that subsides with rest. Which of the following findings warrants additional investigation? Is it A, heart rate of 56 beats per minute, B, oxygen saturation level of 93 on room air, C, blood pressure of 136/80, and D, ankle brachial index of 0.65. Okay, so this is wanting you to recall your assessment skill, especially with the PAD, peripheral arterial disease. What is your answer here, guys? This is a multiple choice. Which of the following findings warrant additional investigation? Letter B, letter B. Okay. I want you to read through the scenario, especially the medical history of the patient. Is this finding going to be a normal occurrence for this patient because they have this medical history, or is this going to be out of the ordinary? So I really want you to think outside the box here. Look into the data. A nurse is evaluating a 52-year-old patient who has a smoking history during a routine clinic appointment. And another information here is that the patient who regularly exercises. Yeah, that's a significant medical history, guys. Smoking, regular exercises. Can it do something about the muscularity of the heart? Yes, it can, especially for those athletic swimmers. Oh man, you're gonna have to see so many of those heart rates, oxygen levels. Okay, so let's get the correct answer here. Let me just reveal the correct answer first, and then we're gonna get through the different other options here. So the answer for this test question is going to be letter D. Let's just park it right there. Answer is letter D. Why? Because when you answer letter A, what is in letter A? A heart rate of 56 beats per minute. As I have said earlier, pay attention to the medical history of the patient, their lifestyle. 52 years old, regularly exercises. Yeah, this can become a normal range for the patient. Especially for those athletic individuals. So they are going to be slightly bradycardic if they are athletics, guys. So when they are in the resting state, usually their heart rate will run in the mid 50s, even in the low 50s. And some patients as well, they feel normal while at rest, even if their heart rate is 48, 47. Yeah, it kind of scares me, especially if they're elderly people and early in the morning, let's say 2 a.m. And when the temperature in the room is very cold, the more that their heart rate will go down. And yeah, I get excited, especially when I worked night shift before for 14 years. Yeah, there's so many things that I have to encounter, especially early in the morning. Oh my gosh. Congratulations, Asante. Came back to say a very big thank you. I passed my NCLEX 3 days ago. This 90 days NCLEX review was very helpful. God bless you and good luck to everyone this platform. Yeah. Wow. Congratulations. Huge congratulations to you. Oh my God. That is great to hear. Wow. That's awesome. Time to celebrate. All right. So. All right. So for letter A, heart rate of 56 beats per minute, and looking into the medical history of the patient, their lifestyle. Guys, don't neglect those medical information. The patient's lifestyle can actually give you some clues. So exercise can probably make their heart rate a little bit or slow. What about letter B? Saturation level of 93 on room air. And our patient has a smoking history. Smoking history. Yeah. So we are actually thinking about a patient that may have a COPD. And so saturation level of 93% on room air can be normal for these people, right? And this is common. And so we are not gonna answer or select letter B. So we are eliminating that, eliminating letter A as well. What about letter C? Blood pressure of 136 over 80. Okay, what is that? A blood pressure that is this high, yeah, it's slightly elevated, but it's not really immediately concerning. It doesn't really require like further investigation compared to the next one that we will be looking at. So we are eliminating letter C. What about letter D? Ankle brachial index of 0.65. What is this? Guys, this is going to be a diagnostic tool that is very important in determining peripheral arterial disease. That is the correct answer. Let me explain. Okay. What is a no? Rhodoline? I want to know, what is that no? Okay, let me get back to you. So when you are doing the ankle brachial index, or ABI, okay, this is a simple procedure that you can do with the use of the regular blood pressure cuff. You're also going to be using the what do you call this, the venous Doppler, or just the Doppler. You're going to use that to listen the pulsation. So here's the procedure, guys. Let me remove this one. Oh, the selection here, it's not select all the apply, guys. This is a multiple choice, so you're only going to answer one option. So what is the ABI? So the ABI basically is like this. Let me remove my handwriting. Yeah. So again, the patient will be placed in a supine position. They should be relaxed and calm. Let them know what the procedure is all about, so they will cooperate, and so there will be less anxiety, right? So what we're going to do here is to measure the patient's blood pressure, the brachial blood pressure, and also we're going to have to do the ankle blood pressure. And we are not going to use really the stethoscope this time to listen for the carotid cuff. What we're going to be using is the Doppler, okay? Or yeah, the Doppler ultrasound. Yeah, I said that. Okay, so here we go. So here, we're going to have to do the testing on both arms and both ankles. And we want to make sure that we are recording them accordingly to capture the differences in the blood pressure. So, the findings here, okay, is actually this. So these are the different severities in an ABI test. So if the patient will have, okay, before I'll tell you that, the ankle brachial index value is going to be calculated by, let me remove that. You're going to divide the ankle systolic pressure by the higher brachial systolic pressure, okay? Again, you're going to calculate the ABI by dividing the ankle systolic pressure by the brachial systolic pressure that is higher. So you're going to make sure you select the correct value here. I know, Zandy, bradycardia, but I have said earlier that the patient is regularly exercising, and that is a common occurrence for these athletic individuals. And it doesn't really warrant a much more immediate investigation compared to letter D. The reason that letter D is correct, it's because the value that we have here, 0.65, falls under this category, moderate moderate peripheral arterial disease. This is very significant, okay? And so if your patient's value falls between 1 to 1.4, that is considered normal ABI. And it's borderline if it's 0.91 to 0.99. And it is mild if it's 0.7 to 0.9. But again, the problem here, the concern here starts to build when your patient is going to have the moderate PAD value or the ABI of 0.41 to 0.69. And of course, the severe. Zandy, I know the normal heart rate is 60 to 100 in the adult. I want you to refer to the scenario here. The patient regularly exercises. This is athletic person. And this person is age 52. They tend to have lower heart rate, which is a common occurrence, especially in an athletic adult. This is slight bradycardia at rest. This is not going to cause more concern. Is it B okay? Normal 93. B, I hope that you're able to listen to my explanation earlier, or I don't know if you just came in. But the saturation of 93 on room air is going to be acceptable in a patient that has chronic smoking or cigarette smoking. They are known to have in this level in the 90s or 88, 89 to 93. I know, C is normal too, 120 over 80. Yeah, so we are going to eliminate that as well. Yeah, you're thinking. That's good. So let's go back to the ABI. The moderate ABI or the moderate value in the ABI and the severe PAD, these are going to really cost us more investigation. Okay. And so that will be our correct answer. ABI. And when this happens, though, you're going to make sure that you're going to report the value immediately to the cardiovascular medical provider, usually the cardiovascular surgeon, in order that they can do follow-up, maybe some more diagnostic testing, especially that this is really going to compromise the blood flow into the distal part of the bilateral lower extremities. Okay, so again, guys, this is going to cause some more concern in your patient. ABI of 0.65. That is very significant. Okay. All right. Let's move on to the next cue. A patient is taking cilostazol or Plital for PAD that causes intermittent claudication. The nurse determines the medication is effective when the patient says, A, I am experiencing fewer aches and pains. B, I no longer have headaches. C, I can walk longer distances without leg pain. And D, my toes are turning grayish black. All right. So we are talking a patient about a patient that takes cilostazol. Question. Please, do you tie the cuff in separate extremities? We are going to check the ABI on all four extremities. Yes, not just one arm or not just the right or just the left arm. We have to check both arms and also checking both legs as well, both ankle. Yeah. So in order for you to get the more accurate value, you're going to select that higher systolic value. Okay. So let me just go back to that previous page. So as I have said, when you are doing the ABI, okay, what you're going to do is to make sure you are going to select the higher systolic blood pressure in the arm. Okay? That would be your divider. Okay? So you're going to divide the ankle systolic blood pressure by the higher brachial systolic blood pressure. All right, moving on to the next, Q7. So your answers here are letter C. Yeah. Okay. I can walk longer distances without leg pain. Now, let's recall what cilostazol is. Cilostazol, or known as the Pletal. So this is a medication that is going to be prescribed for a patient with PAD. And again, I want you to think again that PAD is poor blood circulation, poor blood supply. There is vasoconstriction. So cilostazol will actually cause vasodilation to promote blood flow to the lower extremities. And when you're going to check your patient, when you're going to evaluate the effectiveness of the medication therapy, what you're going to ask is, hey, how are you feeling? Do you feel a lot better while taking the medication? If they say yes, well, that's good, right? They say, I can walk longer distances without leg pain. So that simply means that there is less claudication, intermittent claudication. Remember about the intermittent claudication? This is going to occur when the patient ambulates. The pain will come back because of the poor blood supply to the bilateral lower extremities. And so this can treat that intermittent claudication. So letter C would reveal that finding. Okay. If you had answered letter A, I am experiencing fewer aches and pains. What is that? I am experiencing fewer aches and pains. What is that? Well, the response is quite vague though. This is not going to pertain to the leg. So you will not be able to really determine that the patient's circulation to the lower extreme is getting better because it's not specifying where the aches, where is the relief of pain. It didn't say that. So this is a vague answer. We're going to eliminate letter A. So comparing it to letter C, I can walk longer distances without leg pain. This is the most correct answer. It has that information about less pain in their leg. What about letter B? I no longer have headaches. Well, guys, giving you an idea right now, the side effect of the cilostazol, one of the side effects here is headaches. Okay? And the absence of the headache doesn't really indicate the therapeutic effect for the medication. It doesn't. And so it will not be our determining assessment finding that the medication is working. So we are going to eliminate that as well. Now, letter D, my toes are turning grayish black. Grayish black? Hey, that's not good. That's a bad color there. When you're going to see grayish black, it is worsening. It's a sign of worsening PAD. We don't like black discoloration, or let's say bluish discoloration. We don't want that. Simply means that the medication probably was not taken by the patient. Yeah. So if this is going to be in a home setting, probably they're just going to tell, yeah, I've been taking my medication every day, but looking into their extremities, it's saying otherwise. Maybe they're not compliant to the medication regimen. So again, our best answer here is the patient's response, saying that they have lesser pain in the leg when they are ambulating. All right. Okay. Again, the black toes, this is going to be a sign that there is gangrene. Necrosis. There's no effectiveness in the medication, or maybe the patient is just not taking it, right? it's worsening of the PAD. Okay, so I hope that you're able to capture just the simplicity of my rationale here. All right, so our testing skill here is to make sure you have to focus on the specific symptoms and make sure that you're going to have to go back into the drug mechanism or the therapeutic effect of the drug, which is going to be vasodilation. Okay, that is the main reason that they are going to be given the Plital, because we want them to have vasodilation to the lower extremities to allow adequate blood flow. All right. All righty. Let's move on to the next question. Question number 8. When evaluating an individual with peripheral vascular disease, which symptom would suggest total blockage of an artery in the lower leg? I repeat, when evaluating an individual with peripheral vascular disease, which symptom would suggest total blockage of an artery in the lower left leg? Is it A, dull ache in the left calf, B, sharp burning sensation in the left calf, C, tingling and loss of sensation in the left leg, and D, coolness of the left foot and ankle? All right. Again, the options are dull ache in the left calf, B, sharp burning sensation in the left calf, and C, tingling and loss of sensation in the left leg, and D, coolness of the left foot and ankle. All right. Symptom that suggest total blockage. I'm seeing Mariana answering D, Charmaine. Okay. Tingling and loss of sensation in the left leg, coolness of the left foot and ankle, dull ache in the left calf, sharp burning sensation in the left calf. All right. Let me write the answer first and we will explain about that. The correct answer is letter D. We'll just park it for just a few seconds here. Why not letter A? Dull ache in the left calf. Okay. Lower leg. The lower left leg. Okay. So if you had answered letter A, dull ache in the left calf, this is incorrect because it will typically signify intermittent claudication, right? So this is going to signify or much more associated with partial artery occlusion. Partial artery occlusion. Partial artery occlusion. Pen. Yeah, that's right, Mariama. They still have some blood flow, but not a lot. They have minimal. They will have that dull ache in the left calf. But remember about the collateral circulation that will be formed when the patient develops peripheral arterial disease. So that's kind of odd just to think about it. But yeah, the PAD will have that collateral circulation plus a narrowed artery. Okay. So letter A is something that we are not going to select. Let's put an X to that. B, sharp burning sensation in the left calf. What is that answer? Well, the sharp burning sensation in that left calf is also incorrect because it suggests nerve involvement and it is probably going to be caused by a partial ischemia, but not total arterial obstruction. Okay, so this is going to also signify that there is partial occlusion. Okay, what about letter C? Tingling and loss of sensation in the left leg. Well, the tingling itself is also incorrect because this is going to be caused by a sensory nerve involvement, and this is associated with reduced blood flow. Again, this is not a complete obstruction, so this is also going to be partial. All right. However, if you're going to have the coolness of the left foot and ankle, think about the circulation, guys. When there is already a much more prolonged absence of the blood flow, this is really going to affect the temperature of the patient's leg. Okay, this is going to signify that there is probably about 99 to 100% obstruction. Okay, and so when this patient will have coolness of the left foot, this is also going to lead to paralysis of the lower extremities. All right, so make sure that you have to be careful in selecting those options with the keywords, of course. So tingling, loss of sensation. The tingling is not going to give us an idea that there is total obstruction, because the tingling itself is that nerve sensation. Okay, paleness and coolness. Yep, that's what it is. And so coolness is really going to signify a pronounced impairment. There is a lack, or there is now a complete obstruction. There is now a lack of oxygen or blood flow to that distal extremity. Okay, so that's going to be your clue here. Coolness, whereas the rest of them still has that sensation. All right, moving on to the next, guys. Number 9, a nurse is caring for a patient with DVT who has been on unfractionated heparin for a week. The provider added warfarin 2 days ago, and the patient asks why both medications are being given. What should the nurse say? The scenario said, a nurse is caring for a patient with deep vein thrombosis who has been on the unfractionated heparin for 1 week. The provider added warfarin 2 days ago. The patient asks why both medications are being given. What should the nurse say? Is it A, I will remind your provider that you are already receiving the heparin? B, your lab results indicated that 2 anticoagulants are necessary? C, it takes 3 to 4 days for warfarin to become effective, so heparin is continued until then. Or D, only one of these medications is for treating your DVT. Remember, I mentioned this anticoagulation therapy, the bridging. Do you recall this, guys? The bridging of IV heparin with Coumadin. Remember when I was talking about the I think I was talking about pulmonary embolism, I believe. Yeah. Especially on the acute phase, when there is, for example, the occurrence of a deep vein thrombosis, or let's say, for example, the patient came into the hospital because of pulmonary embolism, and this is detected probably because of so many things. I just want to test your retention here, guys. So let me just write those. I want to make sure that you retain some concepts. Remember about the PE, pulmonary embolism, DVT. This is actually what's causing the PE, right? Most of the time it's going to be caused by the blood clot, right? And when the patient gets admitted to the hospital because of probably the pain in the leg, or it could be chest pain caused by the PE. And of course, we're going to have so many testing in order to evaluate the patient. And one of those is the CAT scan, right? With contrast. And once the patient's CAT scan reveals clot in the lungs, or let's say there is also presence of blood clot in the leg using that ultrasound. Let me just put US ultrasound, blood clot. Oh, I can't keep up. Blood clot. All right. Blood clot in the ultrasound imaging. Okay. Yeah, the medical provider will initiate the order, probably with the use of fibrinolytic agent, okay, which is the clot buster, or fibrinolytic agent, or with the use of an anticoagulant, the heparin. Okay, so make sure that these medications are initiated once the patient's diagnosis is established, let's say DVT or PE. Now, the scenario is talking about two medications involved here. Patient was started on unfractionated heparin for 1 week, and then the medical provider added the warfarin 2 days ago. So, if you had answered the letter A, okay, it states, I will remind your provider that you are already receiving heparin. Well, it simply means that the nurse does not really understand the purpose of the therapy, because there will be that bridging from the heparin into the Coumadin. So it will involve simultaneous use of the heparin IV plus the Coumadin. And I have mentioned about Coumadin, which will be taken or ordered. So let me just draw here. So in order to give you a better understanding about when to exactly get the order. So, let me write it down. So let's say day 1, day 2, day 3, day 4. So day 1 probably would be the day when the patient got diagnosed, right, with PE. DX means diagnosis, PE, or it could be DVT. So this definitely would require anticoagulation. So at this point, most of the time, the doctor will order the heparin IV infusion. Heparin IV. And remember about the heparin, this is a rapid-acting anticoagulant. It can cause the thinning of the blood. It will make it less viscous in order to prevent the growth of the clot, okay? The goal of the heparin therapy is basically to prevent the blood clot to grow, okay? We don't want that. And so during the first day, we will be checking the patient's APTT in order to check for the therapeutic level to make sure that this is safe for the patient. Now, the patient will not be getting the heparin all throughout the admission, okay? There comes a time that the medical provider will discontinue the heparin once the patient is about to be discharged to the home setting. But before that they can do that decision, they're going to have to start ordering the oral anticoagulant, okay? So they're going to order the oral anticoagulant, and that is the warfarin, okay? And again, I've said something about the warfarin that will probably be included during the first day when the heparin was started, or probably a day after or 2 days. It depends on the medical provider. But again, the purpose for the warfarin is to bridge the anticoagulation. Okay? So what's going to happen here? So for example, during the second or third day, so for example, the patient's APTT is stable. If the APTT becomes stable during the third or fourth day, then there is a possibility that here around this time, 3 to 4 days, the therapeutic effect of the warfarin has already kicked in. Remember, I said about the warfarin that it will take good 3-4 days for it to start working inside the body. And so around this time, during the 3rd and 4th day, the patient's prothrombin time will also be monitored. Okay, remember about the prothrombin time reference range that I mentioned in the last few days, that it is, or the INR. Remember about the INR? If the patient is not given a warfarin, then their INR level is less than 1, right? Okay. Ooh, eraser. So pay attention about the INR that is anticoagulated and the INR that reflects anticoagulation, or not anticoagulated, and the INR that is not, oh, I'm getting confused. INR that was not anticoagulated, or the INR that is anticoagulated. So just referring to the Coumadin. So when the patient has the warfarin, the level that we should be looking at will be 2 to 3. Okay, that would be the safe range. It simply means that the medication warfarin is already thinning the blood, meaning the medication is going to exert anticoagulation at this point. 2 to 3, that would be our safe range. Okay, so if the patient's INR is less than 2, it simply means that maybe the medication is not, the dose is not appropriate for the patient. Maybe it's way lesser, or maybe the medication was just started. It's not 2-3 days yet, or it's not like 3 days after the initiation of the warfarin. So we want to make sure that our patient, hang on a sec, let me just erase this because I'm already getting confused with what I'm writing here. So basically, guys, what we are looking for in this scenario is to make sure that we have stable activated partial thromboplastin time and stable prothrombin time, or also the INR. So make sure that the warfarin is working and the heparin is working inside the body. Now, if this is going to be achieved, if the PT or the INR is already achieved, let's say 2 to 3, okay, then that's the time that the doctor will now discontinue the heparin IV. There's no need to keep giving the IV infusion because the oral anticoagulant has already kicked in. Okay, so we are going to proceed with oral anticoagulant. Okay, I hope that you can still read my handwriting. So our correct answer here is letter C. It takes 3 to 4 days for warfarin to become effective, so heparin is continued until then. So once the once the prothrombin time is stable, heparin will be discontinued. Now, if you answered letter D, only one of these medications is for treating your DVT. That is wrong, because again, like I've said, there is that bridging. Don't forget this word, guys. Bridging. I never learned this back in nursing school. Never. I only learned this when I was studying for the NCLEX. Yeah, because back in my student days, we were not really exposed to the anticoagulation therapy. And so, yeah, this was quite a shock to me. So I hope that this is going to stick in your subconscious. Make sure that you're going to recall about the bridging of the APTT and the PT INR. Right? Alrighty. So our correct answer is letter C. Now moving on to the next question. What time is it? 10:50. So this is a patient with a case of a Raynaud's disease. So a nurse is attending to a patient with Raynaud's phenomenon due to systemic lupus erythematosus. Which patient statements indicate comprehension of the nurse's teachings about this condition? Select all that apply. A nurse is attending to a patient with Raynaud's phenomenon due to systemic lupus erythematosus. Which finding statements indicate comprehension of the nurse's teaching about the condition? Is it A, when I am highly stressed, my hands turn pale or blue and feel numb and painful? Letter B, having lupus likely caused this condition. C, I don't need to inform my doctor about new skin issues on my hands. And letter D, this issue arises from temporary poor blood flow in my hands. And E, medications might help manage this condition. This is a select all that apply. So feel free to select the appropriate answer. Okay. So the situation here is on a patient with Raynaud's disease or Raynaud's phenomenon because of SLE. So which statements indicate comprehension of the nurse teachings about the condition? Select all that apply. Mary answered A, B, D, E. Okay. What about the rest of you guys? All right. ADE. I don't know about the connections to lupus. That's okay. That's all right. We'll always learn, Mariama. We'll always learn. All right. ABDE from Franklin. Okay, let's go through. How do you say your name? Is it Venus Ridaran? Gianni? Charmaine answered AD. Erica ADE. All right, let's go through the selections here. If you selected letter A as one of the options, when I am highly stressed, my hands turn pale or blue and feel numb and painful. So this is actually a statement that the patient understands that the disease, Raynaud's, is triggered by the what? Stress. Remember about the triggering factor about the Raynaud's disease? Raynaud's phenomenon. Disease. So remember about the stress that could precipitate that, or what? Cold. Extremes in cold temperature. This can lead to the vasoconstriction. Okay, so when the patient have that kind of like if they are placed in that kind of environment, if they are too stressed, if they are probably staying in Colorado during the winter months, or the Alpine, yeah, they're likely to develop the pale or blue discoloration, feeling numbness and painful sensation in their hands. Okay, stress and cold sensation can lead to the vasoconstriction. So we are selecting that as one of the answers. What about letter B? Having lupus likely caused this condition. Yes, the Raynaud's phenomenon is associated closely with SLE. Okay, so we are going to select that as well. What about letter C? I don't need to inform my doctor about new skin issues on my hands. I hope you did not select letter C, because letter C is not a good statement. Yeah, SLE, scleroderma. That's very good explanation, Deep. If they said, I don't need to inform my doctor, well, that's kind of dumb, right? Why would they not notify? The care provider needs to know if they will develop any skin issues, especially on the hands. That is a wrong statement there. So this is going to be eliminated. What about letter D? This issue arises from the temporary poor blood flow in my hands. Remember about the Raynaud's disease, that it's not caused by the blood clot? Yeah, it's not. It's caused mostly by the stress and the extreme in cold temperature. So it's not permanent. And the blood flow, the impaired blood flow, is not going to be permanent as well. So when they're going to be warmed, they're going to be placed in a warmer environment, the manifestations will also go away. All right. And so letter D is one of those answers. If you had answered letter E, medications might help manage this condition. Is it correct? Yeah? Yes, that is correct. And we're going to talk about the different treatment modalities here. So what are those medications that will treat the Raynaud's disease? Well, there is that calcium channel blocker. Okay. The reason, yeah, very good explanation there, Deep. So our patient will be prescribed the calcium channel blocker, and the reason for that, it has that vasodilatory effect in the blood vessels, of course, in the lower extremities. It will help relaxation of the smooth muscles, so to promote blood flow to the distal extremity. Yes, that's a vasodilator. And plus the cilostazol. Remember about the Pletal that we talked about earlier? That's another one. Okay, so our correct answers here, guys, are letters A, letter B, letter D, and letter E. So the only wrong answer here is letter C, which states that the patient is not going to notify the medical provider as soon as they're going to develop any issues in their hands. Okay. Yes, Zandy, that's correct. Very good. And Charmaine, vasodilators, yes. And like I have said earlier in the management of the PAD, cigarette smoking is going to be a huge factor that can relieve or prevent the what? The vasospasm or the constriction. Avoiding caffeine. What else? Avoiding stress. Avoid extreme and cold temperature. Okay, so those are the main aggravating factors that the patient should know about. Again, avoid stress, avoid cold temperatures. What else? Did I say anything else? I just had a brain fart. Verapamil, nifedipine, diltiazem. Yeah. So those are the calcium channel blockers that will be opted, but not really all of those three, because those are three samples of the calcium channel blockers. Those are all CCBs, right? Let me emphasize there. CCB, calcium channel blocker. Calcium channel blocker. So what is the effect of the calcium blocker, really? Because sometimes if you're just memorizing the medication name, it will not really stick in your subconscious. So supposing this is your cell, right? The calcium channel blocker will actually block that receptor, and this will prevent the calcium ions from going into the cell. All right. So the calcium channel blocker will actually prevent the entry or the influx of the calcium ions into the cell. So when that happens, there will be relaxation of blood vessels. Okay. Vasodilation. This is what we want for this patient because of the vasoconstriction going on. All right. All right. So let's recap. Avoid stress. Avoid caffeine. Avoid cigarette smoke or nicotine. All right, so those are the common stuff that we need to avoid. Avoid stress, avoid caffeine, avoid smoke, and avoid cold temperature. So you might be asked about a patient going to the grocery store, especially in the frozen section. So it's not advisable for them to do the grocery shopping into the frozen section. It can precipitate the vasoconstriction. No kidding, guys. So you're going to have to think about the extreme cold temperature that might precipitate the vasoconstriction. All right, let's move on to the next. We have a situation here talking about a patient with peripheral vascular disease that has had a right femoral popliteal bypass graft. Okay, that's the scenario. The patient is post-op. Oops, let me erase that. The patient has the right femoral popliteal bypass graft. The blood pressure has dropped from 124/80 to 94/62. What should the nurse do first? Or what should the nurse check first? Is it A, IV fluid infusion, B, pedal pulses, C, oxygen flow rate via nasal cannula, or D, capillary refill? Again, a patient with peripheral vascular disease has had a right femoral popliteal bypass graft. The blood pressure has dropped from 124/80 to 94/62. What should the nurse check first? Is it A, IV fluid infusion, B, pedal pulses, C, oxygen flow rate via nasal cannula, D, capillary refill? D, and okay, we're seeing B here from D. Mariama answered B, and also B from Charmaine. Yeah, guys, our patient is post-op, post-surgical. And especially if this is a cardiovascular procedure, SX surgery, your attention here will be geared to checking the pulse characteristic. This is big. We are talking about circulation. This is a big assessment finding, okay? Although you will probably see capillary as an indicator as well for the circulation. However, what we want to establish first is to make sure that the patient's pulse is present, okay? Because I understand these can be used for circulation assessment. However, the pedal pulses will have a much weight compared to the capillary refill, okay? So make sure that the circulation is steady for this patient. So what are we going to do here, guys? When the patient is post-op, we are going to also check for, okay, so what I usually do when I work in the surgical floor, I use the letter CSM, standing for circulation, S for sensation, and M for motor. This is very important. CSM, circulation, sensation, motor. So if you have a patient that may have any kind of orthopedic type of procedure, or cardiovascular procedure maybe, check the CSM, the circulation, sensation, motor. If there is an impairment in any of these, it will require further investigation, okay? Because the circulation might be impeded because of maybe an edema. So that's something that we need to look at more, okay? So what are we going to do here, especially when we are checking for the pulse? What you can do is palpate the distal pulse. So since the scenario said about femoral popliteal bypass, okay, let me highlight that instead. right highlighter. This is located in the thigh area. There is conjunction, or there is now connection, anastomosis of the artery because of that diseased portion of the blood vessel. So there is a bypass that is going on. And so if we are going to check this patient's pulsation, we want to make sure that we are checking the distal pulse, which is way below. Okay, so we are going to look for the pulse. We're going to have to palpate the pulse, talking about posterior tibial, dorsalis pedis. So make sure that you're able to capture pulsations in this arteries, posterior tibial, dorsalis pedis, and then note for the amplitude. Is it +1? Is it 0? Is it +2? Is it +3? Is it +4? So you will know if there is an impairment. And most of the time, guys, our patient with a PAD, especially the immediate post-op phase, we will not be palpating like the +2 already or +3. No, that's not very common. So what we're gonna make sure is, hey, I am still feeling a pulse. This is a good sign that there is now revascularization. There is now reestablishment of the blood flow to the distal part. And so we want to make sure that we are comparing the pulse with the non-diseased extremities, okay? So we want to make sure that we are comparing. So for example, what is this? Is this right femoral popliteal bypass? So as soon as you have completed the pulse check on the right lower extremity or distal pulse, we're going to have to compare it with the pulsation in the opposite extremity in order for us to give an idea that, hey, the patient just had a surgery. Okay, so this is expected. So probably it's still faint, or maybe you will not really feel a pulse. Maybe this is only going to be assessed using the Doppler. And this is very common, guys. Ultrasound Doppler. Have you used those in the clinical setting? So this is very useful for checking very faint pulsation. So the US Doppler will help you in assessing the post-graft pulsation. Okay. Now let's move on to the next question. Oh, we still have letter A. What is in letter A? IV fluid infusion. Is that going to be a intervention that or assessment that we would do first before assessing the pulses? No. We can do this after we have completed the assessment of the pulse. Same thing with the oxygen flow rate via nasal cannula. We can also check that after we had checked the patient's pedal pulse. And according to the scenario here, we don't have any information about hypoxemia. We don't. So there's really no need for us to regulating the oxygen rate. Or let's say the patient's urinary output is low or oliguric, so we don't have that information either. So that will be placed maybe second or third after we have checked the baseline pulse. Okay. Now the cap refill. Yeah, like I said earlier, this is going to be important, but this is going to be a secondary assessment after we have completed the pulse check. We want to make sure that our patient has adequate blood flow, and this is going to be assessed with that pulsation. So always follow your priorities here, guys. Use that circulation as the topmost priority in this scenario. Okay, moving on to the next. An overweight patient on warfarin with dry skin due to poor arterial blood flow needs instructions from the primary nurse. Which instructions are appropriate? Select all that apply. Okay. Is it A, use lanolin or petroleum jelly or on intact skin? B, follow a diet low in calories and fat. C, check the skin daily for new sores. D, limit daily activities. E, use an electric razor for shaving. So our case here is on a patient that is overweight, on warfarin therapy, has a dry skin due to poor arterial blood flow, and needs instructions from the primary care nurse. And we're talking about the warfarin here. So which instructions are appropriate for this client? This is select all that apply. I'm seeing letter B, AE. I'm seeing Deep answering ACE. Mary answered CE. Vinus Ritaran answering ACE. And Zandy answered B. Or no? Yeah? Mariama answered BCE. CFAS answered CE. All right. So the correct answers for this test questions are the following. Let me just write it down here. So that would be letter A. There's also letter B. And there's also letter C and letter A. Okay, so what is in letter A? Use of lanolin or petroleum jelly on intact skin. Okay, so this will help in maintaining the skin integrity, keeping it moisturized. Okay, if you answered letter B, follow a diet low in calories and fat. So our patient is overweight, right? Yeah, I get that the patient is overweight. But when we are talking about this scenario, it is pertaining to the warfarin therapy. And the warfarin therapy is causing her skin to be dry. No, it's the warfarin is not causing it to get dry. I'm sorry. So the patient is overweight, is placed on the warfarin therapy, and their skin is getting dry because of the poor blood flow, not caused by the warfarin. And so what we need to do here is to give instructions to the patient. So what are those instructions that we should offer to this patient? Okay, if we answered letter B, follow a diet low in calories and fat. Okay, how is that? Is that going to help the patient? Yeah, weight loss will improve the circulation and overall vascular health. So this is correct. What about letter A? It is also correct. It is going to help moisturize the patient's skin. What about letter C? Check the skin daily for new sores. Is that appropriate? Yeah, it is. We really need to make sure that we are monitoring the patient's skin. See for any signs of skin breakdown. Maybe redness is another one. Redness, or let's say no blanching upon palpation. When you're going to do this, palpation. Do we get any points for the correct options? Of course. This is select all that apply. Yes. So guys, with the select all that apply test question, all the options that you answered, all the correct options will be scored. So let's say, for example, we have 5 options here, and there are 4 options. So it depends on the NCLEX. Maybe they're gonna let me do a calculation here really quick. So for example, 100 will be divided by the 5 options, right? So this option letter A is going to be scored, that has probably 20% in there. There's also going to be 20% in the B. There's also 20% in letter D, and also 20% of the electric razor for shaving. Okay, so hang on a sec here. 25. Okay, so if the question is asking for 4 correct answers, sorry, that's not 20. So that is actually 25. 25, 25, 25. So each correct answer will have 25% each. Okay. Now, if you are going to answer an incorrect option, for example, you answered letter D. So that is already a 25 deduction to your correct answers. So there will be deduction. All right, let's go back to our scenario. C, check the skin for daily, or check the skin daily for new sores. Of course, that's a good intervention. And then E, use an electric razor for shaving. This is going to be important as we are dealing a patient with bleeding tendencies. So they need to be advised from not using the straight razor because they're going to end up bleeding. Other things would be like no dental flossing. They need to use the soft bristled brush. You got to be careful with their make sure that they're wearing shoes or slippers in the home setting, especially if there will be presence of any kind of like sharp objects. This can potentially cause bleeding as well. That's one. And letter D here, what is this? Limit daily activities. This is going to be an incorrect answer because in the patient with, of course, with the patient scenario here, the patient is overweight, has poor circulation to the lower extremities. We're not going to limit the activity. Instead, we will encourage the patient to move around in order to promote circulation. Okay, so that would eliminate letter D. We're not going to limit their daily activities. All right, let's move forward to the next question. A nurse is developing a care plan for a patient with peripheral vascular disease and heart failure. The plan should consider the patient's reduced exercise tolerance due to A, reduced blood flow, B, increased blood flow, C, less pain, D, thicker blood. The question states, a nurse is developing a care plan for a patient with peripheral vascular disease and heart failure. The patient should consider the plan should consider the patient's reduced exercise tolerance due to A, reduced blood flow, B, increased blood flow, C, less pain, D, thicker blood. A PVD and congestive heart failure. So you are developing a care plan. All right. What are your answers? Or answer rather. This is a multiple choice. Charmaine answered letter A. Mary A. Okay. Yeah. Peripheral vascular disease. That is the hallmark of the disorder. Reduced blood flow. That is the correct answer. And here we are talking about the congestive heart failure. Okay. Why is this going to be significant? As we have a patient that has congestive heart failure, and what's in that congestive heart failure? There is also a decrease in the cardiac output. When that happens, the patient's blood supply is also going to be compromised. All right. So the reason here is that we need to really consider the patient's diagnosis. They have a comorbidity, heart failure. So we want to make sure that our patient will have a safe balance between their activity and also with the treatment regimen, the demand for oxygen. We weren't going to make sure that our patient is able to perfuse the distal extremities. Okay, so blood supply also leading to oxygenation compromise. Right? So if you had answered letter A, increased blood flow, immediately cross that because we don't have increased blood flow in a case of CHF and also the peripheral vascular disease. It's not associated to that. Less pain. Well, pain will typically increase, especially in a case of peripheral arterial disease, like the intermittent claudication. It will be aggravated by the activity. So less pain is wrong. Remember about the intermittent claudication. Now letter D, thicker blood. Well, the viscosity of the blood can be a factor, but it's not really the primary issue in this situation. Again, the problem is more on the blood flow. Okay, talking about the association between CHF and the pre-existing peripheral vascular disease, which can will have a much more pronounced impairment in the tissue perfusion. Yeah, so the answer is letter A. Okay, let's take a look into the next test question here. Question number 14. Thicker blood is referring to the viscosity, the thickness. Yeah. If you're, hypercoagulability, remember about the HES? Remember about the let me erase that. Whoops, eraser. Why is this not letting me? Oh, here we go. HES. Hypercoagulability. If we have that, then there is a tendency to form blood clots. Okay. All right. I'm not going to go back to the HES because that would lengthen. Yeah, it's going to confuse you some more. So we'll just focus on one point as needed. All right. The question here states, during an assessment of a patient with peripheral vascular disease, the nurse notes swelling in both ankles. This edema is caused by A, functional venous valves, B, low blood volume, C, more muscle activity, D, high venous pressure. During an assessment of a patient with peripheral vascular disease, the nurse notes swelling of both ankles. This edema is caused by A, functional venous valves, B, low blood volume, C, more muscle activity, D, high venous pressure. This is a very easy question. What causes that? Is it because of functional venous valve, low blood volume, more muscle activity? Yeah, that's easy to spot right there, guys. Letter D, high venous pressure. Okay, so let me attempt here, guys. Supposing this is the vein in the lower extremity, and this is going to be the valve. Okay. Supposedly, even when the patient is in a standing position, if the valve closes when it should, when the blood passes through the valve, it goes back to the vena cava, right? Gets back to the heart for oxygenation. However, when there is peripheral vascular disease, especially the venous type, PVD, probably there is an impairment of the valve itself. So what's going to happen? Instead of the blood will go up into the upper part of the body, into the vena cava, when the patient is in a standing position, what's going to happen is that this can potentially stay in the venous circulation, and it will cause pressure, increasing pressure into the blood vessel. And remember, if there is that congestion of blood, it simply means that there is also increased hydrostatic pressure. It can lead to that swelling because of the increasing hydrostatic pressure. So that simply means that the fluids will now leak into the interstitial spaces. Okay? So supposing these are your cells. So the fluids will now migrate into the interstitial spaces. Interstitial. Oh boy. Interstitial spaces. That's why you're going to see the patient with edema. And like I said earlier about the discoloration in a peripheral vascular disease venous type, remember about the brown discoloration? That is the hemosiderin stain. Okay, the red blood cells leaking into the tissues. So it will go into the first, second layer, the skin. That's why you're going to see those brown discoloration, and that is caused by the leaking of the red blood cells into the tissues, and it happens for quite a long time, so that discoloration will be looking quite permanent. Okay, now, so that is the reason why the edema is being caused, or the reason why the edema shows up. It's because of the high venous pressure. All right. So if the answer is letter A, functional venous valves, well, it should not lead to the edema. If the valves are working properly, it should not allow the blood to go back down or congest in the veins. Low blood volume? No, of course it doesn't. Muscle activity, increased muscle activity will not do that as well, because with the increased muscle activity, this can also promote what? Will allow the movement of fluids back into the circulation. But looking into D, yeah, you can identify that real quick. Hydrostatic pressure here is very high. Now let's move on to question 15. A nurse assesses the lower extremities of a patient with peripheral vascular disease. Which signs should the nurse expect? Select all that apply. Is it hairy legs? B, mottled skin? C, pink skin? D, coolness? E, moist skin? So this is a select all that apply. The question states, a nurse assesses the lower extremities of a patient with peripheral vascular disease. Which signs should the nurse expect? Select all that apply. Is it A, hairy legs? B, mottled skin? B or C, pink skin? D, coolness? And E, moist skin? Actually, this is lacking that descriptive. So this is arterial. So I don't want to confuse you. Sorry, there was a lack of the word here, arterial, peripheral vascular disease. Again, a nurse assesses the lower extremities of a patient with arterial peripheral vascular disease. Which signs should the nurse expect? Select all that apply. A, hairy legs. B, mottled skin. C, pink skin. D, coolness. E, moist skin. Again, I lacked putting in the arterial word here. All right. So this is arterial PVD. So your answers are B, D, C, E, C, D, A, B, D. Arterial. Remember about arterial peripheral vascular disease? There is what? Decreased blood flow to the distal circulation. Also low oxygen. Okay? We're talking about arterial this time, so what would be your options? Answered A, B, C, D, A, B, D, C. Okay, so the correct answers here, guys, are letters B and letter D. There is mottled skin and coolness. Remember about the arterial PVD? There will be hair loss instead. So A is going to be eliminated. Hair loss, not hairy legs. Pink skin. Pink skin signifies that there is enough circulation, right? Instead, what you're going to see in the PAD is pallor, right? And then the skin is not moist. It will become dry. Okay? Not moist, not pink, not hairy. Okay? So we are left with the correct answers, mottled skin. So what is that mottled skin? Have you seen yourself exposed in a very cold temperature? Not wearing any pants, just pair of shorts. Imagine yourself, you're standing right next to a big refrigerator or staying right next to the freezer for probably good 20-30 minutes. Then you will see the mottling of the skin. Basically, the mottling is that purplish discoloration. Patches of purplish discoloration in the skin. That's what we call as mottling. Mottled skin. So the color will have that purplish discoloration. Basically, it's running out of oxygen. It's not getting enough oxygen. Okay? So, our patient's manifestations are the following: mottled skin and coolness because of the poor oxygenation, poor blood supply to that distal extremity. Okay, so hairy legs, eliminate that one. Pink skin, you gotta eliminate that. Moist skin, eliminate that as well, because those are signs that the patient has enough circulation. Okay, all right. Now let's move on to the next question here. A nurse cannot feel the patient's left pedal pulses. What should the nurse do next? A, listen for the pulse with a stethoscope. B, notify the doctor. C, use a Doppler ultrasound. D, examine the lower left leg. A nurse cannot feel the patient's left pedal pulses. What should the nurse do next? A, listen for the pulse with a stethoscope. B, notify the doctor. C, use a Doppler ultrasound. D, examine the lower left leg. Let me get back to you. So what would be your next step when you cannot feel, you cannot palpate the left pedal pulse? What would be your next step? Would you listen using a stethoscope? Would you notify the doctor? Or are you gonna elevate or examine the left lower leg? Or you're gonna do the Doppler ultrasound? The correct answer here, guys, is letter C. This is the correct answer. This is to assess non-palpable distal pulse. Okay, to assess non-palpable distal pulse. So what you probably would be hearing when you are using the Doppler ultrasound, so you will hear that whooshing sound. So if you're going to hear that faint swooshing sound, then at least you will determine, hey, there's still some circulation going on. But it doesn't mean that your intervention will stop there. You really need to notify the doctor, hey, the patient's extremity, the left pedal pulse is very diminished. I can only hear it using the Doppler ultrasound. The other one is okay. So this would call for a possible immediate intervention by the medical provider once there is that diminished pulsation. All right. So notifying the doctor would happen next. After you had gained some more information, after you had investigated further. You're also going to do letter D, examine the lower left leg. And letter A, well, the use of a stethoscope in assessing the pedal pulse would not be appropriate. Not happening, because the stethoscope will not be able to capture faint pulsations. It will not. So immediately get rid of letter A. So you're left off with letter B, C, and D, but looking into these three remaining answers, you really gotta do your assessment first. Make sure that you're investigating if there is still some circulation going on. Do that with a Doppler ultrasound. Okay. All right. Let's move on to the next question. Looks like... So I'm just reading into Vinus Ridaranjayani's statement. It's not obstructed. Okay, it doesn't look like a question to me. Okay, so I think we're good. Number 17. A nurse cannot feel the patient's left pedal pulses. Oh, sorry, that's done. Number 18. A patient is having arteriogram to diagnose occlusive arterial disease. The test will confirm the condition by, is it A, showing the blockage and collateral blood flow, B, scanning for volume changes, C, using ultrasound to measure blood speed or the velocity, D, measuring walking endurance. Okay. The question states, a patient is having an arteriogram to diagnose occlusive arterial disease. The test will confirm the condition by A, showing the blockage and collateral arterial blood flow, B, scanning for volume changes, C, using ultrasound to measure the velocity of the blood, and D, measuring walking endurance. Yeah, I'm seeing a lot of A's here. Yeah, very good. That is a correct answer. The testing, arteriogram. This is going to be a test that is going to involve the use of a contrast agent. And of course, it will capture any block in the blood flow. And it will also show collateral circulation. So over time, when the patient has developed a blockage, the collateral circulation actually will be established. So these are like your capillaries, very tiny blood vessels that will allow some kind of like a detour, like a bypass, basically. And this is going to happen in chronic PVDs. Now, letter B, scanning for volume changes. What is that? Well, the arteriogram will not going to capture that one. That's not the primary use. Using ultrasound to measure the velocity. Well, this is going to be the action of the venous ultrasound or Doppler ultrasound, not arteriogram. Duplex ultrasound US. Okay. And D, measuring walking endurance, that's not gonna, the exercise testing is not part of the arteriogram. Okay, so let's talk a little bit about the duplex ultrasound. This is a common testing for patients that may have DVT. Okay, so this will identify if there's also blood clots going on, especially in the deep veins. It will identify the size of the clot and where exactly it's located. So just throwing it out there. Okay. All right. So I think we are close to finishing right now. Number 19. Question number 19. During an arteriogram, a patient feels nauseous, has tingling, and experiences shortness of breath. What should the nurse do immediately? Again, during an arteriogram, a patient feels nauseous, has tingling, and experiences shortness of breath. What should the nurse do immediately? Is it A, give epinephrine, B, notify the physician, C, administer oxygen, D, reassure the patient the procedure is almost done? Arteriogram. So again, this procedure is going to involve the use of a contrast media in order to facilitate viewing of the obstruction and also the collateral circulation. And of course, it's somewhat high risk. Patient might develop some allergic reaction. But I really want you to start with the process, nursing process here. Don't immediately jump into the gun. Okay? Don't jump into the gun. Okay. Our manifestations here: nausea, tingling, shortness of breath. Okay. During an arteriogram. So the physician here will be doing the injection, of course. They're going to be in the procedure room while you are the nurse, the interventional radiology nurse assisting the doctor or the medical provider. Lucky you, because you're going to be with the provider, right? Unlike that, when you are a primary nurse in the med-surg setting, you're going to be by yourself. You need to call the doctor via phone, right? But here, you're immediately going to be able to talk with the medical provider. So our correct answer here, what is the correct answer? We're going to have to notify the medical provider. The medical provider needs to be notified right away. These are signs of allergic reaction. Okay, tingling, and also shortness of breath, nausea. So these are your allergic reaction signs. It could be the start of anaphylaxis. Yeah, shortness of breath. I don't like that. I don't want to be a nurse in that scenario. It's quite scary to have a patient developing an anaphylaxis despite you've done your diligent job in screening the patient for all the allergy, and all of a sudden they're going to develop this. Yeah, make sure that you notify, or you're going to talk to the, hey doctor, looks like our patient is not doing well right now. O2 sat is going down. And the patient stated that as well. They're nauseous. That's pretty much a sign that they're not tolerating the contrast media. And so after that, once you have let them know, of course, you're going to end up with getting the verbal orders. Immediately, you're going to have to get ready with administering the epinephrine in order to reverse, to prevent the complete occurrence of the anaphylaxis. We're going to have to prevent bronchospasm, because anaphylaxis will do a lot of stuff in the airway. It will cause bronchospasm. We're going to administer the epinephrine once we have notified the medical provider. So this is our number one. If I'm going to prioritize this, I would answer, yes, that is a correct answer. But if I have to prioritize this, I'll start with one. I'm sorry. I'll start with notifying the doctor. And then also we'll have to either give epinephrine and O2. Yeah, none of these really would like be number 2, 3, because at the same time you can do all these things, or maybe get somebody to help you out with the administration of O2. But again, notification is very important here, guys. Okay. Letter D, reassure the patient the procedure is almost done. Well, that is pretty much like neglecting to address the main issue, which is airway. There's also what else? Yeah, the breathing. The patency of the airway is at risk at this point, so we want to make sure that we're going to deal with that after we have notified the medical provider. Okay. Yeah, we are barely given enough information in this scenario, but if I'm the one taking for this test question, notification to the physician would take priority. Okay. All right, let's move on to the next. During an arteriogram. Oh, that's it? I thought that I had more. Well, we're going to have some more tomorrow. And tomorrow we will be talking about cardiac catheterization as a separate test question, because this is going to be a big deal in the NCLEX. So we will be going through more of the test questions in that procedure. So I'll see you again at 9 p.m. Eastern Time. And I really thank you for your participation today. And congratulations. I forgot her name. What's her name again? Our new NCLEX, our new RN. Very good to hear that. Congratulations one more time. And hopefully we'll be hearing some more NCLEX passers in the next few weeks. All right, that's it for today. Thank you. And you take care. Bye-bye.